Hi everyone, welcome to Nurses Learning Guide. Today we're going to discuss about international patient safety goals. We have 6 goals. Let's see one by one.
This has an important role in patient care.
The first one is identify patient correctly.
Proper identifiers are used to identify the patient. As per the policy, at least 2 identifiers should be there. When you check the name of the patient, it must be 3 names. If the patient has a 3 name, then complete name should be asked. And patient identification also used in upon patient admission, clinic registration before performing any procedures like an insertion of intravenous line or any medications, diagnostic procedures, example taking blood or diagnostic radiology procedures.
The next one is improve effective communication. Verbal and telephone orders not used routinely, restricted to emergency situations only, like in a critical lab test results or radiology or point of care testing. On highlight medication, no verbal or telephonic orders are allowed. Points to remember: write down, read back policy and confirm, and the physician should sign within 24 hours of time or as per the policy. Handover communication between physician to physician, nurse to nurse. This will happen during the transition of care, patient transfer within or outside the hospital, and every shift changes as well.
And the third one, improve the safety of high alert medications.
High alert medications are labeled according to the policy, usually red strip, and whatever the policy in the protocol states. No verbal or telephonic orders are allowed on high alert medications and should be verified by 2 nurses before the administration. Coming to concentrated electrolytes, it should be stored in designated locations separately, and look-alike and sound-alike medications as well, not stored together. Should be labeled properly as well, usually yellow or whatever the protocol and the policy states. The next one is ensure correct site, correct procedure, correct patient surgery. Coming to the surgical section, and I use a checklist or other process to verify the correct site and procedure and correct patient as well, and make sure that all documents and equipments are correct and functional. Coming to the marking, and should be done with a proper appropriate marker, should be used and done by the surgeon as well. Coming to pre-operative surgical safety checklist should be completed. Pre-anesthesia clearance, NPO status, valid consents, site marking and verify, antibiotic prophylaxis administration status if so, necessary investigation reports as well. Coming to timeout, we need to know all these things: verify the patient, correct site, procedure for surgery, all equipments and implants are present, all documents are correct and available and displayed.
The next one is to reduce the risk of healthcare associated infections. As you all know, that hand hygiene is considered as the most important part in reducing the transmission of infectious agents. Policies and procedures are developed to reduce the healthcare associated infections. Organization implements an effective hand hygiene guidelines as well. So remember your 5 moments of hand hygiene practice. The next one is to reduce the risk of patient harm resulting from fall. As you all know, that policies and adequate measures are implemented to reduce the fall risk. Initial assessment of patient is very important. This plays an important role as well. So you need to assess the patient properly in the initial stage. We need to reassess the patient. Reassessment should be done when there is a changes in conditions like an post anesthesia, post cardiac arrest, all our examples. We need to use the proper fall risk screening and the fall risk assessment scale while reassessing the patients. Appropriate measures are taken, such as signboard as per the policy, fall risk screening and assessment, and few things can be carried out like a low bed height, ensure side railing are up, precautionary measures while walking or moving the patient, proper walking aids may use if necessary as well. Coming to the conclusion, we have 6 goals. The first one, identify patient correctly. Second one, improve effective communication. Third one, improve the safety of high alert medications. The fourth one, ensure correct site, correct procedure, correct patient surgery. And the fifth one, reduce the risk of healthcare associated infections. And the last one is reduce the risk of patient harm resulting from falls. Thank you for watching. It's me, Jijo, signing off from Nurses Learning Guide. See you soon with another video. Thank you. Good day.